2 years. Third Wednesday of the month, so we get to catch up with the United Way. Director Cheryl McCulloh in studio, brought Joanne Hermiston along with her of the Women's Health Services. We'll talk to Joanne in a minute. Cheryl, unfortunately, I was not at our golf tournament. I was covering the Sabres at the state baseball tournament. I understand it went well.
Yeah, we missed you. It was a really great day. We had a high number of golfers, 60 some at the first flight and around 30 at the second. It just went beautifully, and we're sorry you couldn't be there.
Understand we're going to raise about $1,600 for the United Way, so a good way to get things started. And the kickoff's coming up next month.
It is September 12th, and we're busy getting all the materials and things ready, and very appreciative of your gift.
All right, before we talk to Joanne, you've got some notes there. Anything you wanted to talk about before we get with her?
Well, the third quarter of the year, United Way focuses on health, and we'd like people to know that what we are trying to do is make sure that individuals and families enjoy good health, and we do that by funding organizations that provide services that help people. So much of what determines a person's health occurs outside of the doctor's office. You think about health, and I go for a checkup, I go in and I'm sick, and they provide me with medication, or I need surgery, or those kinds of things. But it starts way before that. It starts with healthy beginnings, and then through your lifetime, whether it's a chronic illness or a crisis that happens, sometimes you need some support. But even when you don't have those things happen, you need good food and nutrition. You need access to areas for fitness and to keep exercising, and that environment that makes you just healthy physically. We need to have healthy children so they can go to school and learn, and we need healthy adults so that they can go to work and do their jobs.
Okay, and in Women's Health Services, Joanne Hermiston. Joanne, you were telling me 8 years, and you said it has flown by for you.
Yes. Women's Health Services is a great organization, and we are very grateful to United Way and all those individuals and employers and individuals who support United Way to help us do what we do and carry out our mission at Women's Health Services. So,
how did you come to be with Women's Health Services?
Well, I was connected by an individual when they were seeking someone for the role, and I've been in a couple of other nonprofit organizations in the past, and a kind of varied background in finance and customer service and health organizations. So it was a good fit, and I've really loved it.
And your primary role at Women's Health Services is?
I'm the CEO, so I wear a lot of hats, but we all do. It's like many other organizations that get United Way funding, a smaller organization, everybody pitches in and does what they can to serve the patients.
Let's talk about Women's Health Services. First of all, where are you located, and who do you serve?
We're at 2635 Lincoln Way. We're in Suite A in the Westgate Medical Plaza. So we're over by Culver's and Arby's and Aldi's. We serve all individuals, primarily women, but men as well, in a variety of ages. And, we take care of all the reproductive health care needs that individuals have. So we're very excited to do that. We have caring and compassionate staff. We do serve all income levels. So we have probably about 50% of the clients that come to us that have private insurance, and about the other half that are either on some public assistance, or we're providing financial assistance programs for them so that they can afford the care.
Okay, now, how do people get in touch with you? Are they referred, or do they come there on their own, or how does that work?
Both, but we do customer surveys, and primarily we hear that word of mouth from friends or other doctors or individuals in the community. We do have other agencies that refer to us, as well as that's part of what we do for our patients, is we help them by referring them to other support agencies in the community as well.
Okay. Again, so what are some of the services that you do provide? I mean, do you do physicals? Do people come in on a regular basis? If they have children, do they bring their children with them? What do you all offer?
Yeah, primarily we start at about age 14 and up for the individuals that we see. We do sports physicals or work physicals. We kind of added that a year or so ago. But we do a lot of annual exams, with the help of United Way funding and other funders in the community. We've seen over 1,000 individuals, help them get preventative exams. We help with cervical cancer screening. We've had over more than 300 women get cervical cancer screening. 650 received clinical breast exams. We do the sexually transmitted infections testing and treatment in over 2,000 individuals. But another great thing that we do for the community that really makes a difference for us is the health education. And again, another area that United Way is very good in supporting us on. And so we have different programs. We're in the schools, we're out in the community doing community outreach. And last year we helped over 2,700 teens learn about pregnancy prevention, healthy relationships, avoiding risky behaviors, dating violence, lots of different topics that are sensitive topics and that somebody needs to talk to them about.
Very interesting. When you say you go out to the schools, I would imagine you probably start middle school. Is that about the right age, or when do you go?
Primarily middle school, high school. We've done college presentations. We have done some classes and services in the grade schools, more human development type topics in those grades, or nutrition, like Cheryl was mentioning, that whole well-being, not just the reproductive and sexual health aspect, but taking care of yourself. And that's part of coming in for an annual exam. We're looking at their overall health when they come in for that checkup, and then we can refer them for more specialized services if it's something outside of our scope.
Again, visiting with Joanne Hermiston, Women Health Services. Of course, you're located in Clinton, but do you serve just Clinton, the county? What is the area?
We do serve Clinton County, but we also serve Jackson County. We have a satellite clinic up in McCulloh, so we have services up there on a more limited basis, because our primary services are here in Clinton. The other aspect of care that I didn't touch on yet is our prenatal care services. And so we provide a full range of the prenatal care and delivery services, and we do that with the help of our physician. We're very excited to be working with Dr. Mona. She's a very experienced and respected physician in the community, and she embraces our mission and really helps us to take care of the individuals in the community.
Interesting you brought that up, because I was going to ask, what is the staff? Who's all there besides yourself? Who wears many hats?
We have a small staff. We have Cindy Wildemuth, who's a nurse practitioner. We have Crystal, who's our RN, and a few support staff as well. So,
how do you make an appointment? What would be the best route for somebody to go?
They can either call us or they can go to our website and they can pre-register if they're someone new. They can also, if they're already a patient, they can send us messages through our secure patient portal. So there's several ways to get a hold of us.
What is the website, Joanne?
It's womenshealthservices.org.
Very simple, womenshealthservices.org. Again, wrapping up the program with you, anything we did not touch on that you would like to pass along to our listeners?
Well, I just mentioned a couple other specific services. Through funding through the Board of Health, we get funding for rapid HIV testing. So within 60 seconds, an individual can know the test results. So that's an aspect of the sexually transmitted infection testing and treatment that we do. And HPV, getting Gardasil shots, so the youngsters needing that to help prevent cancer in the future.
You offer so much, it's amazing.
It's a very wide range, and it's more expanded than a lot of people realize.
And of course, this program for the United Way, so how does Women Health Services benefit from those United Way dollars?
We benefit immensely. We couldn't do a lot of what we do in the community. Some of our outreach programs, those school programs that we're doing, a new one's called Comprehensive Adolescent Pregnancy Prevention. And so we're going to be introducing some new programs in the middle and high schools this year. So United Way really helps us with some of that outreach, and our health educator who does those activities for us.
Yeah, who does those programs for you? You got one individual, you send them out all over the place?
Yep, our health educator, Krista Brown's our current health educator, and very busy.
I would think.
In a couple of areas that we serve.
Okay, outstanding. Cheryl, again, just one of the many agencies that you do help.
Yes, Women's Health Services is one of about 8 or 9 in the health area that we fund. What we want people to remember is that Clinton and Clinton County are thriving communities, thriving counties, and we need organizations like this to make sure that people have access to healthy foods, healthy health care, and anything to help them have a good life.
Obviously, the need is there, and as you were saying, your campaign's going to be kicking off next month. If people would like to get involved, and that's the primary reason for this program, is to educate them on the United Way, how can they do that?
They can call us at 242-1209. They can go on to our website, clintonunitedway.org, and there's information on there, and we'd be more than happy to talk to them.
Okay, and then when the campaign kicks off in September, how does that work?
We'll be going out talking primarily to workplace people that are employed, but we do have a section that goes to people that are retired or not working, and anybody can call us or drop by our website and give. Our goal is the same as last year, $650,000. Our organizations, such as Women's Health Services, report that they have quite a few people walking in that there is not funding to serve. So as much as we can raise will help everybody in our county.
And you did achieve your goal this past year, right?
We were pretty close.
Pretty close. Okay, well, let's see if we can't get that or exceed.
Yes. We can use every dollar anybody wants to give us, and any contribution will be helpful and
Okay.
appreciated.
Again, appreciate you coming in. Once more, the number and the website.
Phone number is 242-1209. The website is clintonunitedway.org.
And again, Women's Health Services, if they want to contact you, Joanne?
womenshealthservices.org, and our phone number is 243-1413.
Again, thank you both for coming in today.
Thank you, Gary.
I'm a sucker for you.
This is the Dan Patrick Show.
I know Jerry has his reps, but he still says some interesting things. Like his quotes yesterday were as bizarre as anything Irsay says.
He had these quotes. The Cowboys owner is not concerned about getting deals done with Dak, Zeke, and Amari Cooper. Picture if you were the driver of a car and had a wreck and your hand was almost severed off, but you didn't understand your anatomy. This is Jerry Jones. You look down, you're spurting blood. You open the door, you run to the woods, and either die of bleeding to death or shock. The educated man looks down, knows his anatomy, squeezes, and knows his best